It's November 7th. No, it's November 9th, 2020, 9:30 in the morning Central Time. It is already 68 degrees here in mid Missouri. So I hope your weather is as nice as ours has been this past week. It's supposed to get cold again in a couple of days. Today we're going to talk about medical massage. And I have a personal interest and story on this because I avoided surgery and I avoided opioids, etc., long-term opioids, by working with a physical therapist. Good morning, Linda. And working with a medical massage therapist in Oklahoma City. So I had, some of you may remember, I had something that happened when I was 15 playing baseball that affected my right shoulder. So I was playing center field and I threw a guy that was rounding third. I threw him out at home plate and got the ball from center field fence to the catcher with no bounce. But when I released the ball, I heard a big, maybe tearing, or felt like a tearing sensation in my right shoulder. And you could actually hear it. It was kind of like a sound. Hi, Eileen. And so ever since then, intermittently, I will get right shoulder pain. And I actually have some kind of nerve tingling in my fourth and fifth right finger. So my pinky finger and my fourth finger. And I also have some cervical stenosis at 3 different levels, and I have some foraminal narrowing where the cervical nerves come out of my cervical plexus. The actual issue that is found by a massage therapist every time I get a massage is that I have issues in my rhomboids. So those are back muscles. In 2011, that little issue flared up so bad that I wound up on Lortab when Lortab was on the market. Didn't quite understand why people got dependent or took Lortab just for fun, because for me it just made my shoulder pain dissipate. And of course, since you're firing and you're having pain, firing nerves and having pain, then you don't really get a high sensation from an opiate. But the idea is to use them for a short period of time. And so the opioid crisis of the last 20 years or so could perhaps have been avoided. So here's my story. I went and saw a neurosurgeon who felt like he could put metal in my neck and alleviate the discomfort that I was having. However, I wouldn't be able to turn my head to the right. Well, I was a surgeon, and of course driving, you have to look over your shoulder. So I didn't think that was a good idea. There was also some foam stuff that's FDA approved for 1 level of injection by the FDA. And he actually recommended that I go to Germany and have that foam that just kind of separates and improves the space where the cervical nerves come out. He said if you did that in Germany, they would do all 3 levels and you'd be fine in 2 weeks. And then I saw an orthopedic surgeon as well, and I said, okay, so I was on Lortab, and I was on Lortab for about 4 weeks, pretty much 4 times a day, just to function. And so the orthopedic surgeon kind of didn't want to do any surgery at all, and he said, why don't you try physical therapy and medical massage? So that's what I did. So I saw a physical therapist 3 times a week for 6 weeks, and I saw a medical massage therapist once a week for 6 weeks, and lo and behold, they alleviated that pain syndrome. And of course mine, I guess technically it's chronic pain syndrome, since I've had pain in my shoulder off and on. It's intermittent since I was about 15, and now I'm 60. This morning I can sort of feel it. I can always sort of feel it, but it's not horrifying like it was in 2011. Like I couldn't function in 2011. I hurt so bad. So I thought we would discuss, morning Christy, I thought we would discuss the applicability of medical massage therapy for chronic pain syndrome and some other things. So most people think of therapeutic massage as kind of a spa thing, and it's a self-indulgent thing. That if you can afford it, it's a nice thing to do. However, massage therapy has changed over the years so that now medical massage therapists are fairly widely available. One of my students in anatomy and physiology is a medical massage therapist, works in a chiropractor's office. She's doing very well. And I think she's going to also go to physical therapy school so she can put it all together. Physical therapy, which is different than, it was different what my physical therapist did than what my medical massage therapist did. But they kind of coordinated with each other without actually talking to each other, two different locations, but it worked. 4 weeks into it, I was off Lortabs, and I did another 2 weeks. And then when I start feeling that shoulder starting to ache and that kind of neuropathy type tingling and pain in my right hand, then I will get a medical massage. Okay, so massage therapy, medical massage therapy, and I'm looking at an article with 44 publications talking about, 44 talking about what I'm going to tell you about. Okay, so it's been used for lots of ailments. So it's a relaxing thing to do. It feels good. Morning, Holly. And so it's been used for pain and stiffness, anxiety, and even for improved lymphatic drainage. And we'll talk about that. So breast cancer survivors. The problem with the massage therapy is it's hard for an intervention like that to do randomized controlled clinical trials because of the money involved. Okay, so most of the pain management has been FDA drug-centered medicine, and it kind of still is. So we had these recommendations from the CDC in 2016 to avoid opiates until all of these other things had been tried. Medical massage therapy was one of them, and so speaking from personal experience, I avoided opiate dependence, and I avoided neck surgery or invasive stuff around my spinal cord by seeing a physical therapist and a medical massage therapist, and it took 6 weeks, and then I have to update it occasionally. I used to get a massage about when I was in Oklahoma City, at least once a month, at times once a week. Of course, it depends on how much money you're making, because medical massage therapy or just massage therapy in general is not covered by insurance. Opiates they're cheap. For anxiety, a 90 pill prescription of Xanax is $10, and a massage is usually $1 a minute. So a 30-minute massage, 30, 60-minute massage, 60, 90-minute massage, 90, 2-hour massage, 120. Not covered by insurance. So $10 for if you're taking Xanax 3 times a day, which I don't recommend for anybody. It's so addictive. You can get 90 of them 3 times a day for a month. That's $10. And usually there's no copay if you have insurance, but if you're just paying cash, it's $10 at most pharmacies. So, so if you review clinical trial massage studies, they have weaker evidence compared to the FDA drug-centered studies because of so much money that's behind medication-related studies. Okay, and then there's different types of massage, and just like everything, there's different quality or ability of the massage therapist that you're seeing. So there's different avenues for massage, and different massage therapists believe in what they're doing. So you've got Swedish or relaxation and stroking massage. That seems to be better for depression and anxiety versus deep tissue or more pressure massage for chronic pain and then fatigue as well. And then there's a stretching massage called Thai that seems to be better for stiffness. So we're going to go through different clinical aspects of where medical massage therapy can be utilized. So first we'll talk about the opioid crisis. Okay, um, so there is a massage therapist, Robert Kearns, he's a PhD, professor of psychiatry at Yale University, who thinks the opioid crisis could have been avoided um, if massage and yoga and progressive relaxation and other non-drug therapies were used first before opiates. So it's easy to write an opiate prescription because somebody has pain. The idea with opiates is acute pain, short term. But there are people that eventually become dependent because most of them are chronic pain syndrome patients. I saw a lot of them in my addiction medicine practice who were basically dependent on opiates to be able to function, be able to get out of bed. So opiate prescriptions increased fourfold. Prescriptions for chronic pain fourfold from 1997 to 2002. So 4 times higher, 400% more. And so again, they can be helpful for, post-op pain. You broke your arm, you had a car wreck, those kind of acute traumatic events where you really need something stronger than a non-medical intervention. But then as you're healing, if you get past the acute pain phase, you actually don't get any benefit from opiates. Like if you get past 6 months, and of course by 6 months you're probably dependent anyway, so you have to wean. And so many people don't wean, they just stop and they go into withdrawal. But after about 6 months, opiates don't really help as much for chronic pain as what most people think they do. And of course then you get tolerance, so you have to have a higher and higher dose of the same medication. So that's, people that do medical management of chronic pain syndrome find that they're chasing the tolerance all the time. And then there's all kinds of side effects. So people get constipated, they get nauseous, they get sleepy, they're lethargic, etc. So overall, this Yale University psychiatrist thinks that non-medical intervention, and specifically yoga and medical massage therapy, for the long term, would supersede the effectiveness of opiates over the long term. Okay, then there's a thing called myofascial pain syndrome. So fascia is a tissue, connective tissue that winds around blood vessels and planes in your between your muscles, etc. And if that gets inflamed, that is felt to be one of the major components of chronic pain syndrome is fasciitis. So inflammation of the fascia, the stuff that surrounds your muscles and your blood vessels. So if you have inflamed fascia, that's called fasciitis. The fascia is infiltrated with nerves, and that contributes to the sensory pathway perception of pain. Okay. So there's a physician in complementary medicine in Bethesda, Maryland, that showed that there's an increased amount of connective tissue fascia that is found in the lower backs of people that have lower back pain. And so she believes that stretching that tissue with massage or yoga reduces that inflammation and reduces the fibrotic connective tissue growth that's seen in many lower back pain patients. One of my high school classmates is a medical massage therapist, and that's his thing, is myofascial release or treatment of fasciitis. You also see inflammatory change in the fascia from repetitive strain injury like low back pain. So massage therapy seems to reduce inflammation and the fibrosis due to repetitive strains. Okay, so she believes a combination of massage therapy and trigger point therapy has been seen to be effective for carpal tunnel syndrome and repetitive strain injuries overall. And then also believes that medical massage therapy and yoga, etc., can help prevent the onset of that fibrosis and that inflammation in the fascia in the first place. Okay, and then there's a licensed massage therapist in Ohio whose practice is centered on women that have had breast cancer. So it's been shown, for her, it's been shown to relieve. So all this information is from massage therapy conferences, medical massage therapy conferences, where this information is presented. Shown to relieve pain, so breast cancer survivors, anxiety, improve overall well-being in women who have had breast surgery for breast cancer. Okay, so she remarks that, or teaches that tendons join muscle to bone, true. Ligaments join bone to bone, true. But fascia is a thin sheet of connective tissue surrounding and encasing every muscle, nerve, bone, blood vessel, and organ in the body. Also true. That secures them, keeps them from wiggling around, and then links them together. So she thinks manual therapy can reduce fascial tightness and improve blood circulation. And stiffness of fascia has been shown to be associated with cancer growth. So she's doing it as a prevention for recurrence or actually onset of cancer. So she states 60% of breast cancer patients have chronic pain syndrome. And so she uses myofascial massage, applying pressure and stretch to the fascia. She did a clinical trial of patients complaining of chronic pain syndrome after breast cancer surgery, and she compared myofascial release techniques to Swedish massage, which is light touch. And the myofascial pain patients had less pain after myofascial release, had better mobility, and they had a better general sense of overall health. Okay, then we're looking at a guy in Colorado, who's an instructor in massage therapy, looking at treatment for cervicogenic headaches. So estimated 15 to 20% of headaches actually are cervicogenic, so they originate in the cervical spine area, and specifically in the sternocleidomastoid muscle, which goes from the back of your head to the center of your sternum, and there's two bellies of it, sternocleidomastoid. So part of it goes to your cleido means clavicle, so the sternocleidomastoid goes to the mastoid process of the skull to the sternum and to the clavicle. Women tend to have cervicogenic headaches more often than men, and so massage therapy and combining that with neck exercises can relieve a cervicogenic headache. Also reported to help is trigger point therapy of the muscle, the sternocleidomastoid muscle that I just told you about. And so, there's different kind of headaches. So frontal muscle tension headache seems to be the most common, but he's stating 15 to 20% are actually cervicogenic, and they originate around the cervical spine. Okay, for low back pain, a licensed massage therapist at the University of Kentucky in Lexington. That's her focus of treatment. So lower back pain, very common cause of disability claims, lower back pain. And if their backs feel anything like my shoulder, if I couldn't have gotten rid of that, I would have been not able to do anything for the most part. So she evaluates massage therapy for lower back pain, directly seeking treatment from local community massage therapists. So she did a study, 10 massage sessions. Almost half of the patients showed reduced pain after 12 weeks, and 40% showed continued relief of low back pain after 24 weeks, so almost a half a year. She doesn't mention the frequency, but about once a week, I'm guessing. I didn't read this study, probably should have. And then fibromyalgia, that's one of those, they used to call it a wastebasket diagnosis. We can't figure out what's wrong with you. You hurt, it's fibromyalgia. Well, there's actually some markers for that as well now. This is a massage therapist out of Tucson, Arizona, and she specializes in medical massage for fibromyalgia patients. So it's a widespread pain. It can lead to generalized fatigue, um, and fibromyalgia. There's a whole bunch of supplements that you can use in fibromyalgia, but medical massage therapy is one of the staples of treatment for fibromyalgia, so that you can stay off these horrifying immune suppressant drugs and opiates that rheumatologists tend to put patients with fibromyalgia on long term. I mean, things that are just not good for you overall. And so if you can treat yourself, if you can get treated with supplements and medical massage therapy for fibromyalgia, you're going to have a way better quality of life for the most part. So she's showing reviews of a variety of massage techniques showing treatment over 5 weeks to reduce pain, anxiety, and depression. And then all massage type of techniques improve quality of life. Fibromyalgia has also been linked to, and is actually the same thing as chronic fatigue syndrome. So fatigue is a huge part of that. And there are 18 trigger points that you can evaluate that pretty much tells you that somebody has fibromyalgia. So athletes get a lot of massage therapy. This is a licensed massage therapist in North Carolina, gives medical massage to athletes, shown to improve blood vessel function after exercise-induced muscle injury. And then she states that triathlon athletes who receive massage therapy after completion of competition had faster recovery from pain and fatigue in their muscles. Okay? So it's been used to relieve travel fatigue associated with travel for athletic events, where they spend lots of hours in airports and airplanes. So in a well-controlled experiment, they took muscle samples from both legs of healthy young males who'd received massage on only one randomly selected leg after exercise. And the massage leg showed reduced inflammation and increased formation of energy-producing mitochondria cellular components compared to the unmassaged leg. So that's a under the microscope study. Okay, and then manual lymphatic drainage. So this is a massage therapist in Prescott, Arizona, and she has expertise in the type of massage known as manual lymphatic drainage. So lymph is a watery fluid that actually links to the capillary beds and goes through the lymphatic system and back to the heart, independent of the blood circulation. So lymphatic circulation has its own circulation, but it's weak. So blood is propelled by arterioles and arteriolar smooth muscle contraction. So lymph moves quite a bit more slowly than blood. So your entire cardiac output goes from your aorta all the way through your body and back to your aorta through your heart and lungs in about 1 minute. So entire blood circulation of your entire body takes about 1 minute. So lymph nodes break down debris in the lymph before the lymph is returned to the circulatory system in the heart. And then the brain has its own lymph system called the glymphatic system. Okay, it's most active during sleep, and so when you have reduced lymph flow and insomnia because you're not sleeping well, that's one of the reasons you get mental fatigue and mental changes and reduced mental function just from insomnia. Okay, I saw somebody on Facebook this morning that said, I only slept from 4 to 6 a.m., which I guess is her usual, and she had tried taking melatonin and still was up most of the night. So she's exhausted, and she's probably not functioning that well. So manual lymphatic drainage techniques are designed to propel and improve lymph circulation. Okay, so orthopedic injuries, muscle and bone injuries, seem to reduce lymph flow, and that can be improved by manual lymphatic drainage. And then lymphatic drainage prior to varicose vein surgery improves the outcomes. Cellulite has been shown to respond and to be reduced by manual lymphatic drainage as well. Breast cancer patients, they have lots of lymph nodes that get removed in the axilla, which is why they get lymphedema in the arm where they've had their axillary nodes taken out. So about 49% of people, almost 50% of women have had lymph nodes removed in their axilla, their armpit, and get lymphedema, and have to wear a compression stocking on their arm. So manual lymphatic drainage seems to improve that as well. Christy says that she's got a LifeWave patch for that, so I'm guessing lymphatic drainage. So pop on there and say what that is if you want, Christy. Okay, and the massage for anxiety tends to be more of a light touch. So this is the chairman of psychiatry at Emory University in Atlanta. Interested in the effectiveness of Swedish massage therapy to reduce anxiety or fatigue. So earlier research has shown that massage therapy helps with anxiety. It makes sense. So does yoga. So does mindfulness. So does grounding, which could be in a whole other class just on grounding and mindfulness. So this is Mark Rappaport from Emory University, shown that 6 weeks of Swedish massage can significantly reduce fatigue in cancer treatment survivors when compared to light touch. Okay. And so he did blood and saliva samples, so that was people that received 45 minutes of light touch or Swedish massage twice a week for 5 weeks. And he found an increase in the social binding hormone oxytocin, which we talked about in May, and a decrease in the stress hormone cortisol. So he did it by salivary and blood lab determinations. Okay. So basically, the point is, so that's all the, that's basically what I've got for medical massage therapy, and they're different. One of my patients who, when she turned 50, she decided to go to massage therapy school, and she went to medical massage therapy school, and she's going to help me with the shoulder. So a medical massage therapist, they do a lot of anatomy and physiology. They know the medical terminology. The massage therapist I saw had focused on my rhomboids, which is what was hurting the most. And of course that created some neuropathy and nerve stimulation pain, and right on the medial part of my scapula is where I knot up on my rhomboids. Okay, so not my rotator cuff, it's medial to that, more toward my spine. Okay, so the difference between a therapeutic massage therapist, so like a spa therapist, versus a medical massage therapist is that they get after the actual underlying problem. So a therapeutic massage is good. There's nothing wrong with that. They're about the same price, actually. But a medical massage therapist is actually doing things to help the underlying ailment from which you suffer. And I will tell you, having seen lots of therapeutic massage therapists, and now seeing 2 medical massage therapists, they get after it. So the medical massage therapists, they strip tendons, they go after ligaments, lots of pressure point and trigger point release stuff. And so that worked for me for a shoulder injury that's, what is that, 45 years ago. Still dealing with it 45 years later. But that physical therapist and medical massage therapist got after it and got rid of it. It's not completely gone, probably never will be, because every time my medical massage therapist here could feel it. I mean, she knew exactly what was going on, knew exactly what muscles were involved, went after it, and kind of released all the tension that I was having, and improved the circulation in that shoulder. So my symptoms were worse right afterwards for a day or 2, and then better following that. So that's 30 minutes on medical massage therapy. Okay, hope you're having the weather I'm having. It's going to be 75 degrees here today. So it's like fall in November instead of October. And then we get cold again like November usually is. So I'll see you Wednesday unless I get called to teach, and I'll try to do it late afternoon Facebook Live if I get called in to teach. But sometimes you spend a whole day with high school students and the last thing you want to do when you get home is work. So I'll see you Wednesday at 9:30, hopefully, and you all have a great day. See ya. Bye.